Hello. Oh, does this work? Yeah, okay. Hi, everyone. My name is Damaris Paun. I think everyone knows my name already. Just a quick thank you to IGHN for having us here today. My name is Damaris Paun, as I just said. I'm a Roma health development worker working for Pavee Point, Traveller and Roma Centre, and I'm joined today by my colleague, Geraldine McDonnell, who also works in the area of Traveller Health. Today we're just going to go through, as was said, just reflect on our personal journeys and how that has sort of shaped our analysis and our approach to addressing health inequalities. We work for Pavee Point, Traveller and Roma Centre. Pavee Point is a national human rights organisation. We aim to improve the quality of life and living circumstances for travellers and Roma, and part of that work also includes addressing health inequalities as well as working in solidarity with other groups. Today, myself and Geraldine, as two young Traveller and Roma women, will be going through our journeys. So, Geraldine, how did you first start working in the area of Traveller Health?
So I thought mine was off. So just to say, as Damaris already said, so I am a Traveller woman, and just as a little quick background for anyone that doesn't know, we're an ethnic minority group, and in Ireland there's approximately between 45 to 50,000 Irish travellers, and we were officially recognised as an ethnic minority by the state in 2017. So yeah, how I kind of would have got into the work, Damaris, would have been growing up as a traveller. I obviously would have seen a lot of the primary healthcare projects out on the ground, and I would have seen them. The primary healthcare projects are we call it the PHC. So they'd be primarily a group of women, traveller women working in traveller organisations that would come out to travellers on the ground and bring health information. So it wouldn't be any different health information. It would be the general health information that's already out there for the settled community, but it would be traveller specific, and it would be tailored leaflets, etc. As you can see at the bottom, we have a few on display as well. So it would be the likes of these leaflets that travellers would bring out onto the ground. We would get the information, we'd be able to learn about, just say for example, screenings or anything that was applicable obviously at that particular time. So let it be, just say during COVID, the leaflets would have been targeted at COVID, or for whatever else comes up, they're targeted information leaflets. So I would have grew up seeing a lot of the primary healthcare women coming out onto where I lived. I would have seen family members working, and it was more kind of growing up seeing facing the racism and discrimination that travellers do face in Ireland. Being a traveller myself, obviously I would have faced a lot of it growing up, and then seeing the changes that we could make then as women. Sorry, I keep moving the mic from my mouth as well. But seeing the changes that we could make as women and as traveller women as well for your own community, and being able to see that you can be part of the change and make a little bit of change as well yourself. So it would have been seeing a lot of that, and then as I got a bit older, then working in Pavee Point, then only September, 12 months previous, so not September gone, before that, I would have graduated from Maynooth as a community and youth worker, and that's something that I would have, as a child, never thought that I would ever do as a traveller. So to be able to do that has kind of furthered my interest in community work, in traveller health, in women's health, and primarily from looking at the work of traveller organisations would be where my interest would have kind of more or less peaked from that.
Mm-hmm. So in terms of me, I think everyone thinks now I'm from Romania. I am from Romania, but I'm a member of the Roma community as well. Just a bit of background on the Roma community. We originate in India. I know a lot of people don't, they just associate Roma with Romania, and that's it, the end all and be all, but that's not the case. So we originate in India, and we started migrating sort of around the 5th century. Around the 8th century, we reached Persia and Armenia, and around the 14th, 15th century, we sort of reached the Eastern Europe and the Balkans. Now, coincidentally, about 80% of the Roma that are in Ireland are from Romania, but that's just a coincidence. So we have our own language, we have our own culture, our own identity. The language we speak is called Romanes or Romani, and it has more origins in, it's more similar to Hindi than it is to Romanian. It has its origins in Sanskrit. Now, growing up, I was experiencing racism and discrimination. Growing up in a family of 12, where we were often bullied, especially for the way my mother was dressed. I sort of grew up seeing the barriers to access. I had to interpret at appointments, and I had to translate documents at a very early age, and I sort of started volunteering with Pavee Point very early on. And I was sort of exposed to the language around racism, around activism, and so on. I also was able to see that my family had poorer health outcomes, and like found it much harder to access housing than my peers did, for example. So that sort of pushed me on to go to university and get a degree and make a difference. I'm a second generation Irish Roma, and my parents sort of came to Ireland in the 90s as asylum seekers. So that is sort of a bit about the background as to why I got into the work that I got into.
And Damaris, why do you think that the community work that Pavee Point and other traveller organisations would use, why do you think that this would be the answer to addressing some of the issues that me and yourself have spoken about?
Yeah, so the approach that we take in Pavee Point, I'd say at the core is the principles of community work, so empowerment, participation, social justice. I think the work we do around human rights and around equality speak to me as a Roma woman. So we work with different communities, we work with different state agencies, different departments, and we sort of work from the ground up. I think that's what I really like about our work in Pavee Point, that me and you are able to shape what happens for Travellers and Roma at the national level, and we are empowered to do so. Before COVID, we didn't have any Roma health workers in the country whatsoever. So COVID is how my role came about as well. We know from the Roma needs assessment that many Roma struggle to have access to a GP and medical cards. 1 in 4 Roma women attend maternity hospitals for the first time to give birth. Another thing that I find really important about Pavee Point is the holistic approach we take to health, and including a lot of the other factors of social determinants that affect one's health, and the reasoning behind why someone doesn't attend an appointment, rather than just seeing it as a thing of ignorance. There's a lot of learning that the Roma Health Project has done from the Traveller Project, and we have learned a lot from you guys, from the National Traveller Health Action Plan, for example. And now it's a critical time in terms of Roma, especially given the Roma Health Action Plan and its development in the coming year. And we hope to see a robust plan around this and a sort of a whole government approach to it.
Thank you. And I think, just touching off what you're saying as well, I think another perfect example of what we've done in Pavee Point is we have a website called Mind Your Nook, so it's youngpavees.ie, Mind Your Nook, and that's a play on, similar to yourselves, we have our own language as well, Cant or Gammon, it depends on what part of Ireland you're from. So playing on that, we felt that it was the need, and we would have had like a lot of focus groups with young travellers and stuff on the ground, and it was determined from them themselves that there was a need for a traveller-specific website in terms of your mental health. So although I'm a health worker, my specific role in Pavee Point is as a traveller community development mental health worker. And we took the approach of working with young travellers on the ground to see what they felt were the needs in terms of their mental health and what they saw as issues. And then we kind of adapted a website specifically for travellers. And the name of that website is a play on our own language. So Mind Your Nook being your head. So it's kind of like looking after your head and your mental health. And we see this as very successful. It's actually on, if anyone wants to have a look at it, if you go onto our own Pavee Point page, you can scroll through and you can find youngpavees.ie at the bottom of that and have a look at it. But basically what that website is a perfect example of what Damaris was speaking about. So we worked directly with young travellers. They were the ones themselves that identified the issue. So it was travellers talking for travellers and working with travellers for travellers' overall health. So it wasn't somebody else coming in and saying, oh, well, I think this A, B, and C, here's what we should do, or here's what we can do. So we worked with travellers. If you go online, we tackled one of the issues that travellers face being low levels of literacy. So we have an AIR icon specific on the website. So travellers can just click the AIR and it'll read everything that's written there. And we have travellers ourselves, like we recorded the audios, we have travellers in the images. So travellers themselves have said, when we got a little bit of feedback back from travellers in relation to the website, they said that it was great to see that they could see themselves through the website. They knew it was a place when they clicked in where they could see information targeted for them. They saw information specific to them. But like everything that we do in Pavee Point, we don't want to take away from the mainstream. So for an example, we've just used the Mind Your Nook as a way of, it's a targeted approach working towards the mainstream. So on each individual resource, we worked in partnership as well, which is obviously a big part of our work. So we worked in partnership with the HSE and other main bodies. So for example, if there's a young traveller that's having issues relating to the body image. Well, we have a specific research or resource on the website that's called body image, and then at the end of that we have it linked directly to Bodywise, so we're always targeting towards the mainstream. So we're not trying to have segregated services for Travellers and Roma. We want Travellers and Roma to have the same outcomes from the mainstream services, but this is just a perfect example of that approach that we're doing.
Yeah, so I think the main message of what Geraldine is saying, and the main message that what I was saying, and so far, and even throughout the course of the remainder of our conversation, is the fact that we want nothing about us without us. So we want to be that voice that is able to, and for a lot of, like, although we are the largest ethnic group in Europe, there's over 12 million Roma in Europe at the moment, our needs are often ignored. And that is another reason that I got involved in this, and Geraldine herself, in order to make sure that those voices are there, present, and at the decision-making spaces. Geraldine, what do you hope to see in the future for Traveller and Roma Health?
Well, I would like to see the same standard of living, or the same life expectancy basically, for travellers and Roma as what there is for the settled population in Ireland. So what this basically means is a lot more data collection and ethnic data collection. So I'd like to see that across all services, and in particular the health services. So we do know through our own research that travellers are actually dying approximately 15 years earlier than the general population. So in this day and age, I just think that's shocking figures, and it shouldn't be something that is the case. So we'd like to see ethnic data collection for travellers as mandatory, so that as any traveller entering a service, that we can basically say in so many years' time, as of right now in 2025, we're dying 15 years less. So we'd like to see in so many years' time that we can look back and say, well, look, we're improving slightly and keep improving, and to be able to actually have the same results as the general population. We know that through some of our own research in Pavee Point, that every year there's an excess of 134 traveller deaths than what's meant to actually occur naturally throughout that year. And we know that that is purely down to racism and discrimination that travellers face within the health services. And we actually have other examples where the health services themselves have actually admitted to being openly racist and discriminating against travellers. It's like Damaris's point that she said earlier as well, where we don't want to see, oh, well, they just so-and-so, Damaris didn't turn up for her appointment. We want to know why. We want to know why that's not followed up. We know that there's no postal services to a lot of traveller sites, so therefore travellers are obviously missing appointments, therefore their health is deteriorating. We want to know more about the social determinants, why travellers' overall health is at such a poorer level than the general population. We want to improve the life expectancy, and we want to be able to compare it basically with ethnic data going forward and make some changes for travellers.
Yeah, I think very, very important. But also I would say that when I attend a health service, and when my family does, and when our community does, and when your community does, and when all of our communities attend a health service, we should be treated with respect. We should be treated fairly. We should go in there and not be, at the point of contact, be let off by, put off by the attitude of a receptionist, for example. I think for that we need mandatory anti-racism training for all healthcare staff and all healthcare workers. We need to incorporate that in their training, but also we as NGOs working for the rights of our communities should be involved in shaping that training. One of the main take-home messages I would say would be that health policy alone is not going to solve health issues, and there is a very, very big need to look at the wider piece and take into consideration accommodation, racism, employment, education, and every other factor that affects everyone's healthcare.
I just think, on touching off Damaris' point as well, I think another thing that we could have going forward would be more funding for, as I spoke earlier about the importance of the primary healthcare workers. We know through some of our research as well that over 90% of travellers get their health information from the primary healthcare workers. So like I said, similar to the Mind Your Nook website, it's a lot of traveller-specific research and traveller-specific wording, and it's how we are able to clearly understand the messages that are given out, and that we don't have to, the language is targeted for us and the images are something that we can understand. And I think the importance of having better pay, like a lot of the primary healthcare projects across Ireland, they're overworked and they're often underpaid for the work that they're doing, and the importance of the primary healthcare projects isn't seen. So this is something that we'd like to see, and we'd like to see kind of better terms and conditions for the primary healthcare projects across Ireland. But I think also most importantly is, like Damaris said earlier, about not in for us without us. I think travellers and Roma we deserve a seat at the table. We deserve, for example, today, there's no reason why Travellers and Roma should have to fight to have their voices heard or to not be part of spaces like today and to have our voices heard and to be part of decision making when it comes to Traveller and Roma issues and Traveller and Roma needs.
Okay, that's us. Thank you very much, everyone, for
Thank
listening
you.
to our conversation.